Okay, for the next 45 to 50 minutes, I'm going to review foot and ankle ultrasound. Disclosures, consultant for Bioclinica, book royalties, Elsevier, grant from AIUM, and research equipment from Harvest Technologies are my disclosures. So the ultrasound technique was just demonstrated. So we're going to go right on to talk about pathology. So first I'm going to talk about trauma to a tendon. So basically when you have a tendon abnormality, you can try to put into one of these categories. You can have tenosynovitis, which is inflammation around the tendon or the peritoneum, tendinosis or tendinopathy, which is tendon degeneration, and tendon tear, which could be partial or full thickness tear. One comment I want to make about terminology, because this is always confusing. First of all, when you have a partial thickness tear, you can have an interstitial or intrasubstance tear, or if it goes to the one surface, this is also termed a partial thickness tear. Now this is where the confusion begins, because first of all, we know that this is a full thickness tear with retraction. But the question is, what do you call this? There are some groups that are trying to use this terminology that can be used with any tendon in the body. For example, a full thickness tear of the rotator cuff goes from one surface to the next. So that group is now saying, well, this is technically a full thickness tear from one surface to the next, but it's an incomplete tear, similar to what we discussed in the rotator cuff. Other people feel that that description is confusing and that this is actually a partial tear. In the end, I get around this by just simply calling it a longitudinal split. Now, some people will use the term partial longitudinal split if it goes to one surface, or a complete longitudinal split. In the end, I'm not quite sure how to describe these tears, but just be aware that when you read research, that there are different descriptions. In the end, I would ask what your surgeon would like for you to call them so that you can communicate effectively.